Shekhar Potkar, and excuse me if I could pronounce your name correctly. And he's the current regional manager regional medical director of emerging markets and global NCD excellence at Viatris, and followed by Francesco Branca, who is currently the director of the Department of Nutrition and Health Eating of WHO. And our third panelist is Thomas Anker, and he is currently an investment director at the World Bank at the International Finance Corporation. So first, I would like to invite Shekhar Potkar to join us, and he's going to present us a presentation named "What has been the role of the private sector in strategic intersectoral partnership for building back better in NCDs prevention and care." Shekhar, you have 15 minutes. Please, the floor is yours.
Thank you very much. Thank you for the introductions, and I hope I'm audible. And let me share my screen. And very nice to see you online, Mark, again after a while. First of all, let me start by highlighting this is such a wonderful opportunity to be here with all of you today. Can you see my screen? Let me again confirm.
Yes, okay. We can see it.
So thank you for the opportunity to join this NCD forum, which is built around building back better, which is a very topical conversation that we are all having. I'm excited to join this esteemed panel with Mark and all the panelists that we have today. This is a very important conversation for us to discuss the role of private sector in the intersectoral partnerships and how can we play a role in building back better. So I'm going to talk about our experience from biopharmaceutical companies like Viatris. Let me start by providing you what we already know. This is a summary of the context. I think all of us are aware that we have witnessed, or we are witnessing, a deadly collision of non-communicable diseases and COVID-19 with significant consequences around health, around social economics, as well as the equity impact that we have seen in our part of the world. What it has done, it has exposed fault lines in the health systems around the world. And we really have become urgently aware that what we need, if we have to prevent the pandemics in the future, we need strong health systems, healthy workforce, a resilient workforce, and healthy populations. And this need is even more so in low and low middle income countries. That is our part of the world. At the same time, this pandemic has unleashed an opportunity, a crisis of opportunity. They say that every crisis leads to opportunity. So this is a crisis of opportunity. The opportunities, they cover a wide range of areas. Areas like innovation. We have witnessed innovation like never before. Drugs, biologics, vaccines. We have seen civil society engagement like never before. We have witnessed digital disruption. That's another huge opportunity that is lying ahead of us as we shape our future of how do we prevent the pandemics. And finally, there is a visibility of health in front of all stakeholders, the governments, the ministries of health, the civil society, the private sector. I think we have a clear visibility around health. So these are the opportunities that have been unleashed because of this deadly collision. Against this backdrop, if we were to look at what is the role that private sector organizations, especially the biopharmaceutical companies, can play. So I would want to frame this in three broad areas. There is a conventional role that biopharmaceutical organizations play, the role which is unleashed by the pandemic, the intersection of COVID and NCDs. Here, the role of connecting the dots becomes very important. And third, and the important one, which is because of the digital disruption, and how do we leverage the digital disruption? So these are the three frames that I would want to talk about, giving some of the examples from Viatris perspectives. But before I go there, let me highlight the 4 principles that we believe in our experience. There are 4 principles that we want to undertake before we enter into any collaboration. When we enter into collaborations and the partnerships for building back better, our endeavor is to see if we can come up with solutions which are locally relevant. It is very important for us to solve the problems which are locally established. We have evidence. So evidence-based local solutions is the first start point. The second paradigm I would like to propose is the solutions need to be anchored around implementation science. We know a lot about NCDs and the solutions and the risk factors, but the outcomes still lag. And that is because primarily how do we address the implementation gaps from what we know versus what we see in terms of outcomes. So the solutions need to be anchored around implementation science. The third principle is we cannot do it alone. So we need stakeholder partnerships. We need subject matter experts. We need collaborators who share the passion, who share the cause. And finally, because of the pandemic, I think we have never before opportunity to reimagine and leapfrog. Not something, we don't need to do it incrementally anymore. We can leapfrog on what we have already achieved because of the disruption caused by the pandemic. So these are the 4 principles. So let me then explain some of the examples that we have seen in these 3 broad areas. How is the private sector role changing over a period of time? I think, let me start with the conventional role. I think all of us are aware of the conventional role played by the biopharmaceutical organizations in medicines, drugs, biologics, vaccines. The biopharma also plays an important role in collaboration with the stakeholders like medical societies, like the academic medical organizations, the technology companies in medical education. We also have an important role to bridge the gaps between the data and the evidence that we see, especially in low and middle income countries. And finally, there is an important role played by biopharma in providing clinical practice tools, the guidelines, the risk factor assessments, so the calculators that we have. So how do we improve the clinical practice? So these are the broad themes around which conventional biopharmaceutical collaborations have been in place. These all have a very important role to play in improving the NCD prevention and care and improving the outcomes. But what has pandemic done? The pandemic has really highlighted the connection between the NCDs and the COVID. We often call this a syndemic. And this is really providing us an opportunity for the private sector to connect the dots in policy, connect the dots in practice, and improving the patient outcomes. And here are some of the examples that we have seen. In terms of policy, I think we definitely have a role to substantiate the NCD investment case of how do we really create a strong business case for investments in NCDs. We collaborated with Defeat NCD very recently last year and highlighted of how the pandemic, every dollar that we have, the infrastructure that we have because of COVID, that can be leveraged for treating, preventing and caring for NCDs. So that was a report which was published by EIU, and that becomes a good base for us to really start using and shaping the policy. In terms of practice, we are entering into a strong pilot in one of our countries, South Africa, where we are establishing a syndemic action plan. And this is again an excellent example for us to really utilize the COVID infrastructure, the COVID testing, as well as COVID vaccination infrastructure for utilizing for NCD prevention and care. And finally, we have an example around patients. Because of the pandemic, the mental health is another area which is becoming substantially at the front and center. And how do we drive mental health solutions? So that's another area where we are able to connect the dots. Let me give the third pillar, the third theme of how the private sector collaborations are changing. And this can be explained if you look at the disruption in the form of a patient journey. We are all aware that the patient journey is typically in 5 steps: awareness, screening, diagnosis, treatment, and control. These are the 5 steps in patient journey. And there are a number of opportunities which are offered by digital because of the patient journey consideration. If you look at awareness and screening, we can definitely improve the awareness because taking advantage from the digital disruption, which is now we are all witnessing. We are collaborating with IAPO, the International Association of Patient Organizations, to establish Patient Academy, which will empower and enable patients to participate in the decision making. When you look at diagnosis and treatment, the other two pillars of a patient journey, we have a huge opportunity of improving the leakages which are happening from awareness to diagnosis. As an example, we see a substantial gap. Almost 1 in 3 patients who are hypertensive get diagnosed, and only 1 in 10 are controlled. And if we have to control that, if we have to manage this, we have an opportunity here. So telehealth, how can we leverage telehealth and telemedicine? And this is a pilot that we are doing in one of our countries, Thailand, to see how we can improve the diagnosis. And finally, how can we improve adherence? And here we can really leverage the enhanced awareness of the patients to see if we can provide nudges, utilize the principles of behavioral economics so that patients can stay on therapy much longer. So 1 in 10 patients who are controlled, that reality can change, and patients can stay on therapy much longer, and that can lead to improving patient outcomes. So these are just some of the examples from medical scientific perspective of how the private sector collaborations can change from the typical conventional model to connecting the dots and finally leading to leveraging the digital disruption. And this is all happening because of the realization that we need not view the crisis as crisis, but it can be viewed as an opportunity that we can leverage. So let me summarize what I have tried to articulate here. This is an unprecedented opportunity offered by the crisis. We are all aware that the 2030 NCD agenda, we are currently lagging, but we still can achieve it. And if we have to achieve it, it is still achievable if we can invest in NCDs and if we can really accelerate the progress by driving the key enablers. And the enablers in my presentation here, I've tried to articulate 2. One is connecting the dots, and second is how do we leverage the disruption. So I hope that gives you a frame from biopharmaceutical companies' perspective of what can be done if we have to play the role actively in driving the NCD prevention and control agenda. Thank you for the opportunity.